Now with Dr. Jason Wilson from Tampa General Hospital joining us. Thank you for taking some time, Dr. Wilson, on this very busy Thursday.
Happy to be here. It's an important issue.
Yeah, let's jump into this. When we hear that these variants are more easily transmissible, does that mean the things we're doing now, the masking, distancing, hand washing, are less effective in protecting us?
Well, it doesn't mean they're less effective. It means we have to double down and really take doing those things very seriously. We still struggle sometimes to remember to wear a mask when we go places, to stay outside, out of crowded indoor spaces, and to socially distance when possible, to wash our hands. So even though the vaccines are coming and rolling out right now, it's double important right now to make sure we're doing this public health strategy we've been practicing now for almost a year.
And you mentioned the vaccines. We're seeing that there's some of the vaccines have shown to offer the same level of protection against the UK variant, but the South African variant, we heard Dr. Fauci yesterday saying that it was slightly less effective. Does that give you any concern when you hear that?
Well, the idea right now is still to get as many people vaccinated as possible because the most common variant is still the variant we know about. And so the more vaccines we can get out, the better. Now, certainly we have to watch and make sure there's effectiveness against the other vaccines. The Moderna vaccine seems to maybe be a little bit less effective, but they've even made a booster essentially for that. So we'll have to watch that closely. But right now, we just want to make sure everybody gets vaccinated.
Yeah, that's a good point, too. The health experts have been quick to say these vaccines can be tweaked, can be modified to offer more protection against these new variants that pop up. Back to the other things we do to protect ourselves when it comes to mask wearing. Do you recommend wearing 2 masks?
Well, I always joke that I'd be happy right now if people could just wear 1 mask. So let's start there. And if we get that down, then certainly if you have an immunocompromised condition or any other medical problem that is seriously compromising your immune system, or you're older, then you might be a person who needs to wear 2 masks, especially in more dangerous situations like going out in crowded spaces. But again, I'd be very happy if we get to wearing 1 mask consistently, and then we'll get to 2 masks. There does seem to be some added protection for wearing 2 masks against these more transmissible variants.
Yeah, you got to think it's just an added layer, an added wall between you and the world there. And we've heard that the N95 masks are kind of the gold standard, but those are tough to find. What do you think is the next best thing?
Yeah, so we've got these cloth masks out there. You could always double up a cloth mask or wear to make sure you're wearing a 2-layered cloth masks. And then after that become just sort of the standard grade medical mask, things like surgical mask and medical mask. And then even the Chinese variant KN95 mask, as long as you're coming from a reputable dealer and not a counterfeit type of mask, can add some protection as well. The CDC website has a list of dealers and manufacturers of those masks.
Hey, we're really short on time here, but I got to ask you this. How long do you think mask wearing is going to be with us here? Because I've heard that even after people get their vaccine, the recommendation is that they continue to wear a mask for some period of time.
Well, that is certainly true right now because not enough of us have the vaccine to make sure we're not transmitting virus to other people who don't have the vaccine. But once we reach that level of herd immunity from vaccination, we may be able to get past wearing masks. So whether that's 70%, 80%, or 90% of us being vaccinated, there likely is some light at the end of the tunnel where we can go back to walking around outside without a mask on. But right now, we've got to do it and double down on it, especially the Super Bowl in town.
Yeah, definitely got to keep doing it. The CDC said hopefully by midsummer we could have that herd immunity. Let's just continue to forge on with the safety measures we have, and hopefully we get there soon. Thank you, Dr. Jason Wilson, for taking some time to talk with us here live on the 4 o'clock news.